everything seems to start with sensory awareness, whether we're talking about tactile touch, or we're talking about visual, or we're talking about auditory, or we're talking about interoception, the feelings we have inside of us of what do we need and that's our bodies are telling us about. So that awareness and how does how does the body respond to that awareness? I've had the experience with babies who were slow to listen. Well, so when they were tested, they failed their newborn hearing screenings, and they might have done that several times. And so thinking way back to how people began to challenge themselves, how are we going to test babies' hearing? And it's not just the behavioral testing, which we use in audiology. You press a button if you hear, or if you're a little kid, you drop a block into a bucket if you hear the sound. And we have visual ways of capturing a child's attention and hoping they'll respond. But people way back in the 70s were beginning to use cardiac responses and non-nutritive sucking because babies would, if they heard, they would pause. I
Mm.
got some idea of how brain and ears and eyes were working together.